This segment is sponsored by VCU Health.
The doctor is in and you have questions. COVID-19 is now one of the leading causes of death in this country. Today, we're joined by Dr. Gonzalo Bearman, Chair of Infectious Diseases at VCU Health, to discuss battling the current surge and the rollout of the COVID-19 vaccine. Dr. Bearman, it's wonderful to see you. Thanks for joining us.
Good morning. Thank you for having me on the show.
An important conversation. My first question for you is, what do we know about the COVID-19 vaccine? Certainly the medical community is very familiar with this, but for our audience watching today, what do we know about the COVID-19 vaccines?
Well, the two major vaccines to discuss are the Pfizer and the Moderna vaccines. The vaccines were developed very quickly. They weren't started from scratch. They really leveraged growing technology with mRNA vaccines, and you couple that with tremendous prioritization and funding by the government, you get the development of a rapid vaccine. The vaccines from the studies over thousands of individuals, over 70, 80,000 individuals, show that they are very effective in preventing clinical infection, severe infection from COVID-19. And the efficacy is like 95%, which is really fantastic. Certainly greater than we anticipated roughly 6 or even 7 months ago or 8 months ago. We've also learned that there are side effects such as soreness in the arm, sometimes flu-like symptoms for 24 to 48 hours, but generally severe side effects are very rare. So it's an effective and safe vaccine. It's critically important right now to manage and to minimize the risk of COVID-19 in the community.
You covered two of the questions, certainly, that are top of mind. How is it administered and the potential side effects? Another question most folks have is, how was this vaccine developed so quickly?
Right. So again, it leveraged technology that had been growing over the years on the use of mRNA, which is a special kind of genetic material, which essentially tricks the body into thinking that one is infected with COVID-19 and developing those antibodies or the protein to fight off infection. This has been in development, or mRNA vaccines have been in development for years, and really prioritized now to come to the market through funding and through focus, and it's been really quite successful. So that's how the vaccines work, and we're really optimistic it's going to have a significant impact on COVID-19.
Dr. Bearman, many individuals are extra hesitant to get the vaccine. A recent study showed that 15% of Hispanic men and women would choose maybe not to get the vaccine. What would you say? What is your advice? What are your words of wisdom?
Well, for that population, I would say I understand your concerns. I happen to be from Argentina, so I'm Latin American by birth and by upbringing also. I understand your concerns. But again, these vaccines are very safe. They were studied in a cross section of the population, which included Latinx individuals. So we didn't see any adverse events that were greater in that population. It was just as efficacious, whether it was in Latin Americans or in African Americans or Caucasians. So again, proceed with the vaccine. It is really the best option we have to prevent COVID-19 infection.
Good insight. And as we wait for the vaccine to continue rolling out, what are the words of wisdom and advice that you're sharing with the general population as we wait for our vaccine?
Well, I guess I'm very enthusiastic that a lot of people are requesting the vaccine, but my response is you've got to try to be patient. There's a massive demand all of a sudden and less supply than was required right now. So please continue to work with your local provider or your primary care doctor or your clinical health system. I would strongly encourage people living in Virginia to check the VDH website regularly for vaccine updates on availability and links on how to sign up for the vaccine. Many healthcare systems, such as my very own, VCU Health, has information specific to the vaccine and availability and how to sign up on the website of the hospital. So I would encourage people to check that out also.
Incredible to know. Be persistent, but also be patient. It is a delicate balance, but it is one that we have to do. Dr. Bearman, thank you for making time.
Absolutely. Thank you.
A pleasure talking with you. We'll share more information, and here it is for more information about VCU Health. Visit their website, vcuhealth.org. And stay with us. Virginia This Morning returns after this break.